Good morning, I'm Jessica Lovell. Today we bring you an encore presentation of one of our very favorite programs. We'll still be live with you this summer, Monday, Wednesdays, and Fridays, and then come September, we'll be back with our regularly scheduled programming. Until then, enjoy this encore presentation and make it a great day. Coming up on today's Morning Medical Update, it can be embarrassing to constantly excuse yourself to use the restroom. But you're not alone. As many as 40% of women in the U.S. live with symptoms of an overactive bladder. We explain the treatment that can give you your life back. Today, we are talking about urinary incontinence, treatments, and when your bladder problems could be a sign of a more serious health issue. Send in your questions at YouTube, Facebook, and email us at the Medical News Network. You can find links to those right there on your screen. We'll get to those here in just a bit. Urinary incontinence, the loss of bladder control, can happen really to anyone. It's especially common, though, in older women. Why? The National Institute on Aging reports it can happen due to a weak bladder or pelvic floor muscles, overactive bladder muscles, or damage to nerves that control the bladder from diseases such as MS, diabetes, or even Parkinson's disease. For men, problems are linked to the prostate gland, often caused by inflammation, injury, or damage to the nerves, or an enlarged prostate gland. So if any of this sounds like you are not alone, especially if it causes you to avoid those normal day-to-day activities. The good news, though, is incontinence can often be controlled. So we want to introduce you to one of our patients, Tracy Mason-Solis, and urologist, Dr. Casey Kowalik. Good morning, ladies. How are you?
Good morning. Thank you so much for having us.
Okay, we're just going to dive right in and talk all about it. There is no question off limits, and I've already got a few of my own. So Tracy, what was your experience with overactive bladder? Kind of take us through the day-to-day.
Well, I was 41 and I was diagnosed with cancer. And after I finished that, I had gone to see pelvic floor therapy, and my pelvic floor therapist sent me actually to Dr. Kowalik for help because I was tired of peeing my pants and peeing in my bed. I felt like a child again. So when I saw Dr. Kowalik, she ran a couple tests, or I think one test, and confirmed it. And the next thing you know, she's like, hey, we have this magic thing that can help you.
We love magic things.
and so we, it's over a 2-part surgery. I had what they call the biostimulator put in, and it looks like a little key fob. If I feel like it does light up, and all the lights mean is if I need to change it, go up in one, I can. But I've been able to stay pretty stable now for like 3 or 4 months.
So I want to talk more in detail about that technology and why you were such a good candidate. But
okay.
You kind of squirmed when I said, tell us what it's like, because you are not the only one. People watching are not the only ones. You're saying this really interrupted, you said interrupted you being able just to come here to the health system to spend a day testing.
Yeah, I would have to pack 3 or 4 pairs of pants with me all the time. It was limiting my social activities because I was like, oh, I can't go. I've drank a gallon of water. And then if I had a day of appointments, I didn't drink because I was afraid. So, yeah, believe me, when I finally had the guts to admit to someone that I was having this problem, it steamrolled from there, and you just follow every step that you're told to do, because all you're looking for is help at that point. Once you tell people, I am peeing my pants, I don't want to be a 40-something-year-old peeing her pants. I would much rather be able to leave the house and not worry about it. and continue a social life.
So, doctor, let's talk about what our bladder is for and how is it supposed to function normally?
So the urinary tract is composed of 2 kidneys, and then you have ureters that drain the kidneys down to the bladder. And then the urine tube, so the urethra, is where the urine exits the body. So the kidneys make the urine, and the bladder is supposed to be that storage organ that fills up with urine. It's kind of like a balloon, and so as the bladder fills, it should get bigger. And then when you're in a socially acceptable position, at the bathroom, that's when your brain signals your bladder that, okay, it's time to use the restroom.
All right, what causes this? I was telling you before the program, I had a baby at 41, a C-section, and so some people have said, well, that shouldn't be a big problem. Tracy had a cancer diagnosis. What are all the different types of things that might lead to this? And then what are the degrees of severity? And then we'll talk about the treatments.
Yeah, so a lot of risk factors for overactive bladder or urinary incontinence. One of them being pregnancy. Vaginal deliveries are also a risk factor, but even if you've had a C-section, obviously you were pregnant, so a risk factor.
See what I did there? I just admitted I had the same problem you do, so it's okay. We're all
we
friends
can all
here.
talk about it.
That's right.
Aging is also a risk factor for having worsening bladder symptoms. And then there is a large genetic component. And so if your mom had it, then it's likely that you may also have overactive bladder.
So interesting, because I remember when I was younger and you would see these incontinence commercials, and I thought, wear a diaper or wear a liner. Who does that? And then I had a baby and I go, oh, I see who does that. Yeah. Oh, it's all making sense now. It's really interesting. So, so let's talk about pelvic floor exercises, because that's something you were doing before.
I tried everything.
Okay.
So yeah, I was with Eileen in pelvic floor PT, and we were working on trying to make the pelvic floor stronger. And it just didn't. But you have to also add, though, that I have a neuromuscular on top of everything else. So it's very similar to MS. So it has they're like cousins. And so the symptoms are very, very relatable. And at one point I was just like, okay, there's only so much I can do for pelvic floor. And then that's when I was like, sent to the great doctor over here.
So would you consider Tracy then a pretty severe case?
Yes, I mean, I think, unfortunately for Tracy, pelvic floor physical therapy wasn't quite enough, although for a lot of men and women, pelvic floor physical therapy can really improve their symptoms and improve your quality of life. It can be something as simple as sort of doing the exercises on your own at home. We have a lot of great resources on the internet through the American Urologic Association website about how to do these exercises. I often send people to pelvic floor physical therapy because then they can really get that hands-on training to make sure that they're recruiting every possible muscle within their pelvic floor to help improve their urinary symptoms.
And then they can take that and practice it at home.
Exactly.
So let's talk about this device, sacral neuromodulation?
Sacral neuromodulation.
Sacral, okay. I don't do big words.
Yeah,
that's
okay.
why you're here,
That's
Doc.
okay.
So let's talk about that and who makes for a good candidate and who just simply might not.
So sacral neuromodulation is a technique that it can help women and men with overactive bladder. So that's that type of bladder symptom that's like, I got to go to the bathroom and I got to go right now. And it cannot be delayed. And oftentimes, if there is any sort of delay, it can even be 30 seconds to a minute, some men and women will have urinary incontinence. And so we usually go through a sort of an algorithm. So I often will encourage people to do pelvic floor physical therapy. There are some medication options, but like in Tracy's case, pelvic floor physical therapy and medications were not quite enough for her to get to the quality of life that she was looking for. And so after that, there are some procedural options, sacral neuromodulation being one of them. And then another treatment that viewers at home may have heard of is Botox injection into the bladder is another option.
And I want to talk about that here. Just Botox is being used for many, many things.
Yes.
I want to see that device one more time because this is, I know, good show and tell. So you have this like key fob that looks like a car key fob. And then tell us about the device that's then implanted and then how it's monitored outside of the body and how do you work yourself through this therapy?
So it's the device is implanted over 2 procedures. And so the first procedure is me placing a lead surgically through the back along one of the nerves to the bladder. So the sacral nerve roots help control bladder function. And so we place this lead along the S3 or third sacral nerve root. Tracy and other patients, they then try it out for a week or two to make sure that they get a good improvement in their symptoms. And if they do, then the second procedure is me placing a battery underneath the skin, so then everything is on the inside.
And is the idea to eventually get that back outside of the body and have her go on and maybe go back to floor exercises, pelvic floor exercises, or is it probably there to stay for the long term?
It's probably there to stay because the bladder itself is going to continue probably to get worse with time, unfortunately. There have been some cases, you know, the nerves are very plastic and so they can adjust over time. So there are some times when maybe the battery needs to be replaced and patients don't even notice that it's actually been turned off because their nerves have changed over time.
All right, so here's the fun part. You got to tell us how much better you're doing.
I have to say I'm doing so much better. I don't have to leave the house with extra pair of pants. I'm able to have a normal functioning life again, and that just feels so great to be able to just leave the house, not worry about if I'm drinking. It's just great. And this, like, I can tell when it needs to be replaced or it needs to be pushed up, because you'll see, like, it lights up, and you know, and it's like 1 through 2, but you can gauge it, like you just move it up 1 dot.
If you're feeling an urge.
If I'm feeling an urge, I can just, like, with the up arrow, I can just kind of push where I need to be, and it will keep vibrating. And it will stay there.
I want to put a QR code up real quick, because if you're watching and realize that anything that we're talking about is you.
It does have a QR code.
But that has a QR code. We're going to put one up on the screen, because this will take you to some other options. You can scan it, find out, you know, just more information about what we're talking about, and then it'll take you to ways that you can get some better treatment and hopefully get results like Tracy has gotten. Dr. Kowalik, the sneeze and pee, is this what we're talking about? Let's just say it. I mean, this is, how many times if I ask a friend, like, well, do you know, have that issue? Oh yeah, like when you sneeze, you know, is that what we're talking about?
That's a little bit different.
Okay.
And
did I just say too much?
No, it's perfect. It's perfect. It's perfect. I'm just picturing myself standing there sort of crossing my legs when I'm about to sneeze.
Exactly.
And I know I'm in good company. So that's a little bit different. What Tracy has was overactive bladder, that I gotta go right now.
Got it.
What you're talking about is called stress urinary incontinence. And that's urine leakage that occurs when there's an increase in abdominal pressure. So like coughing, laughing, sneezing, exercise, bending over. It has the same risk factors as overactive bladder, but it's a little bit different reason for why it's occurring. We all have a muscle that's between our urethra and bladder, and that muscle, when we do cough or sneeze, is supposed to prevent the leakage of urine. But again, with aging, pregnancy, that muscle weakens with time, and so then we can no longer hold the urine.
So does that then, is that a precursor maybe that will lead to overactive bladder? Is that telling you something?
Not necessarily. They're very two different pathophysiologies, so sort of two different reasons why they occur. And a lot of women have both, which is challenging because it's two different treatment options. But we also have a lot of great treatment options for stress incontinence, you know, what you're talking about with coughing, sneezing.
Okay, so what if you're somebody who gets up a lot in the middle of the night? Is that normal? We know that's now interrupting sleep. That can cause its own problem. Any advice on if we know we need to seek help if we're getting up 2-3 times a night? Is that normal?
Yeah, so almost everybody over the age of 30 gets up at least once a night. The key is hopefully you can just fall back asleep and it's minimally disruptive to your overall sleep. But when people are getting up 2, 3, 4 times a night, that's really when it starts to affect somebody's quality of life, increasing the risk of falls overnight, just that sleep deprivation the next day. So some sort of simple behavioral things that you can try would be making sure that you're limiting your fluids for about 3 hours prior to going to bed. A lot of us, we don't drink a lot during the day because we're busy, and so we try to catch up at night.
I always have that cup of water next to my bed.
Yep. Exactly.
I'm drinking water up till the very end.
Yeah, and so then you're going to be up 2 to 3 hours later, because that's just your normal body's processing of that
And it's
water.
telling you have to go to the bathroom.
Yeah, exactly.
What I'm hearing is you need to go to pelvic floor therapy.
You think I need to go to pelvic? You are now the doctor. You are telling me. You are the expert.
Yeah.
I know you are.
Yeah.
Okay, I'm going to take your advice, and I will consult with Dr. Kowalik, and we'll get me better. We'll get me better, because yeah, I do. Oh, I know. I have a question. What about when you go to the bathroom, but then you get up and walk away, and
you got to go again. 30
and you
seconds
still
later.
have to go? Or you're still going.
Yes, and it's sort of the American way, right? We're so busy, we have so much to do. We just want to get to the bathroom and get back on with our lives. You really should try to take a minute in the bathroom. You want to be sitting in a relaxed position if you're a woman. If you're a man, just be in whatever position is comfortable for you. Don't hover over the toilet. That's so bad for your pelvic floor muscles. So really, you want to sit.
So you want to sit when you're ready to go?
Yep.
Like wait till you really have to go and then go?
Not necessarily. You just want to be sitting instead of, I think a lot of women, especially in public, have this habit of not sitting on the toilet. They kind of hover over it.
But
you can't.
Yes, okay.
Yeah, you can't release your full bladder contents when you're doing that.
So sit.
So sitting, making sure you're sitting, feet on the floor, nice and relaxed. Go to the bathroom, maybe sit there another 10 seconds, see if a little bit more comes out.
And some bathrooms, Doc, I'm sorry, are not a place to relax. You want to get in and get the heck out as soon as possible.
I hear you.
I know. Okay. So many more questions, but let's turn to Dr. Dana Hawkinson. So there's a potential new oral drug in early stages of development to treat COVID. What are your thoughts on this? What could that mean long term?
Yeah, I mean, I think this is one good thing. We are continuing to look at oral options, other things to reduce your chance of hospitalization, severe disease. This can do it. It's similar to what we have. But we also know that when we're treating viral illnesses, we are always on the lookout for resistance and resistance mechanisms in those viral isolates to those particular drugs. That is one of the reasons we have to treat things like HIV with combination drug therapy as well. So I think it's good. It is one more thing that we can use early on to help reduce your risk of hospitalization. And I think there will be more that come out as well as we continue to have more and more research into this.
And pharmacies reporting shortages of amoxicillin antibiotic. What concerns could that create problems as we head into the winter? Your thoughts?
Yeah, I mean, I think overall when we have shortage of any therapeutic or pharmaceutical, it's a concern. We know, I've already talked with our head of infectious disease pharmacy here, Nicole Wilson. They were kind of aware of that several weeks ago, so they ordered it here at the health system. We, quote unquote, should have enough, but you never know. We also have to make sure we are using those antibiotics judiciously and use them when we need them. We just talked about 2 viral illnesses. This antibiotic, amoxicillin, will not help or treat those viral illnesses. So it's important, number one, to practice good antibiotic stewardship, order the antibiotics when they're needed. But again, anytime you have a pharmaceutical shortage, it can impact people's health, and it is a concern. But right now in the health system, we are okay with that.
Let's check and see if we have reporters on the line. Let's get to our community questions, and shocker, we've got a bunch of them. I am going to ask you this, though, Dr. Hawkinson, first. Angela wants to know, they're working on an RSV vaccine, correct?
Yeah, they are working. Again, we've had a couple stories about the RSV vaccine that's given to pregnant moms so that they can transfer those antibodies, those protective antibodies, to baby. But they are also working on RSV vaccines, and we've seen new data and information or press releases in the older populations as well. And so that is one thing. Unfortunately, RSV vaccine has been really tried to be worked on and researched for the past 40 to 50 years. But now I think there are lights at the end of the tunnel for both pediatrics and adults.
All right. Jean, thank you for this question because it was my next one. How does this work on men? If you're going to use the device, or what advice do you give instead of like pelvic floor muscles? What do they do to help ease this problem?
So men, anatomically, they also have a prostate, which can influence the bladder and the bladder control. And so with men, I often have to get additional specialized testing to determine whether their symptoms are being caused from their prostate or from their bladder. If it is determined that the bladder is causing their symptoms, the like frequency, urgency, the getting up at night, then sacral neuromodulation is a great option for men as well.
But it could mean a bigger prostate problem, correct?
But it could be an underlying issue of a prostate problem, correct?
Can overactive bladder lead to bladder cancer? Does one connect to the other?
No, luckily.
Okay.
So overactive bladder is not a risk factor for bladder cancer. But of course, we always have that in the back of our mind. And so men or women that come in reporting that they've seen blood in their urine, that would be something that I would look for before going on to treat their overactive bladder.
Okay, interesting. Leslie wants to know, Tracy, what's your advice to someone who might avoid seeking help because they think it's embarrassing? Hopefully our open conversation today helps ease that a bit and know that this is a conversation women and men are having, probably more women than anything. But how would you help somebody walk through that conversation?
I think that we as patients are more embarrassed than the doctors are. I can't say that when I went to Dr. Kowalik that I was like, I'm so sorry, I'm peeing my pants. But I think I felt more embarrassed than she did, and because I immediately was relaxed, because I started to realize that I was not the only one, just because there's these tests out there, there's these doctors out there. They wouldn't be out there trying to help us if it wasn't a problem. So for me, getting over the embarrassment and seeking help was the right option to do. And I would do it 100 times over. And I have told everybody I've talked to who has this problem, have it done. See if you're not, see if it's an option. Because it's a very embarrassing topic, but embarrassing topics have to be spoke about.
They absolutely do. We are talking about it today. What about bedwetting? Does bedwetting have anything to do with that? Tell me, I'm just going to say it right now. I was a bedwetter. I was a long-term bedwetter. I thought I was ever going to get married. That's how long I was a bedwetter. It was. But my parents were both bedwetters. Did I just admit that? Is that weird? Okay. But what does that mean? Is that an underdeveloped bladder, or is that an or what is that? Or are they not connected at all?
They can be connected. And so particularly as a child, bedwetting, luckily most people grow out of it. And a lot of times it's that your brain is just not waking up to the normal signals.
I did grow out of it. I am telling you now.
Okay. Okay. I'll believe you.
Thank you.
We're happy that because you got married.
I know. That's what it all came down to. Finally, I kicked the habit.
But some people, as they get older, find that they start wetting the bed again at night. And it's a really challenging problem to treat, I must say. And so a lot of behavioral things can be helpful, like limiting the fluids at bedtime. And then also overactive bladder treatments can be
limiting
helpful.
the fluids, the things that I tell my kids to do.
Yes.
So now you're just having to take the same advice.
Yes, you can't have that cup of water.
I do it every night, every single night. Okay, so let me find it. Oh, Botox. Let's talk about Botox. Yeah. Monica's asking about that, and you had brought that up earlier.
So Botox injection into the bladder, like you mentioned, Botox is being used for a lot of medical diagnoses these days, but it is very effective for the treatment of overactive bladder. It's an office procedure, which is nice. It does have to be repeated about every 6 months because, like Botox, with any other reason, it does wear off.
Okay, Kathy wants to know, what is your opinion of the over-the-counter remedies? Is it Azo that we see? Azio? That's one. But just curious, is that a good place to start?
I think that's an okay place to start. I have a lot of women who say that really helps their bladder, and if it helps you, that is fantastic. But there are options beyond that also can be more helpful than just the Azo. Okay,
Isaac has a good question. Asking about if I hold my bladder too long, if I hold it, quote, we've all held it for all sorts of reasons. If I hold it too long, he's asking, could my bladder burst? But what can that, damage? We talk about that. If you aren't doing that, it can cause some type of damage. What can it cause?
If you do that chronically, so I have a lot of nurses and a lot of school teachers that say, I've held my bladder for 8 to 10 hours at a time every day for the last 20 years. So doing that chronically can really cause issues with the bladder long term. If you do it once or twice, not going to be a big deal. No, your bladder won't burst.
Okay.
But doing it chronically can cause problems down the road.
Bladder infections? How common? Those are pretty common. And
common.
How are those connected?
Yeah. So urinary tract infections are super common, particularly in postmenopausal women. And it actually really all has to do with the estrogen levels in the vagina, because it affects the pH, which allows all these bacteria to survive.
A UTI, those are evil.
They're evil. They're horrible.
Evil.
They're so horrible.
They really are.
I know.
Okay, so what else do we need to know about other bladder issues? If it's not overactive bladder, but we talk about UTIs, all that kind of stuff. But anything else we need to be thinking about?
Be aware of. Yeah, I think interstitial cystitis is also a bladder condition that a lot of men and women have. I would say the most common symptom of that is particular foods will bother your bladder. So if you have spicy food, you may notice the next day that you have a bit more irritation of the bladder. And so my advice to those patients is kind of keep a food diary and start determining what foods it is that's affecting your bladder.
Kathy asked, does caffeine have anything to do with this? Please say no. Please say no.
I'm sorry. Yes.
Okay. It does.
Yeah.
It's diuretic.
It's a diuretic, so your body's going to produce more urine, and it also can be irritative to the lining of the bladder. Now, that being said, I'm never giving up my cup of coffee.
I knew it.
Just how it is.
Okay, good. Now that's doctor's orders I can get behind. What about cranberry juice?
So cranberry juice, that's actually a common myth.
Okay.
Cranberry in a concentrated form, so cranberry pills, the active ingredient can help prevent some urinary tract infections, but the juice itself does not have enough of that active ingredient.
It will not help you get rid of one, that's for darn sure.
It will not help you get rid of one, no.
But is it good for you? Just for good bladder health overall, not necessarily?
Not necessarily. If you like cranberry juice, feel free to drink it, but it's not going to help prevent urinary tract infections.
Angela wants to know, does this help with prolapse?
No. So
okay, what is that?
So prolapse is when the bladder is dropping into the vaginal space. Again, a lot of the same risk factors. So pregnancy, vaginal delivery, particularly if you had a baby that was over 9 pounds. There's also a genetic component. So a lot of women have prolapse and overactive bladder.
Oh boy. Okay.
Yeah.
So
all these pelvic floor conditions, they all go hand in hand.
Okay, so I'm going to ask, I got to ask Isaac's question. He always has questions, so I got to get this one in.
Okay.
Question for our guests: why do I have to go to the bathroom after a movie, even after I've already gone beforehand? I don't drink anything during the movie. Is it because I drank more fluid than my bladder can hold before the movie, and that my trip to the bathroom beforehand simply sets the stage for whatever urine is held back to be transferred to the bladder, thus making me have to go again by the time the movie ends? Did you get all that?
Yeah.
Okay,
so
help him out.
It's probably something behavioral. So maybe if you're eating anything salty or drinking stuff right before the movie, even if you're not drinking during the movie, you're probably also unconsciously delaying your urination because you don't want to miss a part of the movie. And then I think there also becomes this habitual habit, that if you watch a movie and then you always go to the bathroom, your body's kind of primed, like, okay, the movie's over, now it's time to go to the bathroom.
Gotcha. Okay. Before we get to our final thoughts, just any water always going to be the best thing to drink for
water's the most healthy thing
always
to drink, yeah.
Always. Any foods though that can maybe just be pro bladder?
No real foods that have been identified as pro bladder. Some foods that have been identified as anti bladder.
Okay, what are those?
Some like citrus foods, caffeine, alcohol.
And moderation.
And chocolate.
And what?
I know. I didn't want to say it.
Oh my gosh.
Sorry.
Okay, Tracy, have you cut chocolate or caffeine out?
I'm not giving up my caffeine in the morning either.
No. And you should not. And you should not. This is so interesting. You will have to come back.
Yes, absolutely.
You will have, both of you will have to come back. Let's get to some final thoughts. So, Tracy, I'm going to start with you. Just any advice, any parting words? What do you want us to know, just again, about taking kind of our health in our own hands?
I just kind of want to say, don't be embarrassed at all. I mean, Jessica and I have let it out this morning.
We sure have.
And if we can go on here and admit it, then I think that people should be able to get over their embarrassment and go to the doctor and get help, because it's a normal thing of getting a little bit older. And you notice I say a little bit older. Right. Little bit older.
Thank you. I talked to a doctor in the health system, and they said, you've got to go see Dr. Kowalik. So
yeah.
You've already been referred. You have a referral coming your way.
Yes.
So
yeah.
And I'm glad you said that. You're right. If people can talk about it out in the open and admit their body's just their body. It does all sorts of weird different things, and you just got to find the right help.
Fix what you don't admit.
Love that. Love that. Dr. Kowalik, final thoughts from you today.
Yeah, I mean, I think kind of along what Tracy was saying, a lot of people out there, their bladder is controlling their life. They know where every single bathroom is, hesitate to leave the house, and if that describes you, there are a lot of options out there that can help you.
Anne wants to know if obesity is a factor in bladder problems.
It can be, yep. So maintaining a healthy weight and staying active, it will also help you maintain a healthy bladder.
It just staying healthy anywhere and any way you can, always going to help. Dr. Hawkinson. Lots of information today.
Yeah, no, like I said, I think this is relevant in like all of our shows, but you know, I think this might be a silent problem that affects so many people and their quality of life. It was good to have everybody on, and it's glad to know that there are some things that can be done to help with that quality of life factor as well.
So, Dr. Hawkinson, you just know a little bit more about us today, right?
Yeah, that's good.
Always good. All right. Thank you to everyone who was on today, and thank you so much for being with us.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.